Hi everybody, it's Dr. David Gustitis from Rhythm of Life Chiropractic in Franklin, Wisconsin. And today I want to talk to you about how at Rhythm of Life we take a corrective, whole body approach to spinal care for the pediatric patient. Our kids fall all the time. From when they're very little learning how to walk, they fall dozens of times a day. They can fall off the changing table, they can fall off their bed, they can fall down the stairs, maybe they fall off their bike. They collide with their friends and they play contact sports, run into the soccer ball, you name it. Our kids fall a lot. Now nowadays they use their phone every day. So from an early age, they're using a device that causes their head to look down. Now the device doesn't necessarily cause them to, but most kids, most adults even, look down at this device. That leads to poor posture. If you're doing that every day, day in and day out, that's going to shape the spine to an abnormal curvature. And the combination of those injuries and poor postures may lead to complaints, may lead to a headache, may lead to, the injuries might lead to a soreness afterwards. Most parents, because of the frequency of these injuries, they often ignore them because they know the child is going to stop crying. And it happens so often that you can't address every single one of them. I mean, that's several trips to the urgent care every day. So what we do is we triage it and we decide, you know what? Let's see if this one's severe. If they stop crying, we can probably carry on and move on and see how we're doing. But if those complaints of the child start to persist, or the child, maybe they're complaining about a headache, or they're complaining about their back, or their neck, or their knee, or what have you, if they continue to complain, then we, as parents, we step in and say, you know what, we should get this checked. Let's go get them evaluated. And if they come into my office, we will take a corrective whole body approach to that pediatric spine. And what we do is we look at alignment on a couple of levels. We look at the segmental alignment of the spine, which, according to this model, you can see the two vertebrae and how they should be relating to each other in alignment. If they're misaligned, that's going to put pressure potentially on the nerve or on the disc and cause a problem at this specific level. But misalignment can also happen, like I was saying before, with poor posture that's developed over time. So we can also have misalignment on a global scale where we have misalignment from left to right or from front to back where we lose normal curves that get straightened out or reversed. So we check alignment. Number two, we also check motion. Each pair of bones have joints in between them. And if those joints are healthy, there's movement there. There's also movement in a region like the neck, but there's 7 bones in the neck that each of them should have normal healthy motion in between each of those bones. The neck, the mid-back, the low back, the pelvis, range of motion in the extremities, that's motion. We should have normal movement in the spine. And lastly, we need proper nerve function. So the spine's other job, besides being a structural support for our body and the structural anchor for the muscles as well as the extremities to anchor to, it's also a protective armor pathway, an armored protected pathway that allows the nerve channel from the brain to the body to pass through without injury. And it allows the spinal cord as well as the nerves to branch off while having protection in that pathway. That nerve function needs to be there in order to allow the muscles to work, the organs to get proper signaling from the brain, as well as those body parts to send normal signaling to the brain. So alignment, motion, and nerve function. Those are the 3 main components of our assessment. Now, once we find out what's going on, we look and see what the root cause is of whatever's happening in the child. Then we can go about restoring alignment, motion, and nerve function. We do that through rehabilitative approaches. The spinal adjustment through chiropractic care is gentle, safe, and effective to restoring motion to vertebrae that have become stuck. It also helps to restore alignment. It breaks up scar tissue and allows those areas to rehabilitate. Now the next layer of this is to help the abnormal curvatures to come back to where they should be. So if we're looking down at our phones and we develop a loss of curvature, we need to work on rehabilitating those muscles and those ligaments and those nerve pathways together. Because if we stop at the adjustment and we leave those abnormal curvatures unaddressed, then chances are those misalignments at the bone-to-bone or segment-by-segment level will return, because this kind of a neck will lead to abnormal loading of the spine that down the road will cause future problems yet again. So we try to take, like I said, that whole body corrective approach so that what we do today will actually lead to better health tomorrow, not a repeat over and over with time of the same problems. Chiropractic care done in time, done early, can help to prevent future problems. I see that in my practice all the time. I see patients coming in after problems have developed, they get under care, they get the root cause addressed, and then if they stay with it, if they stay on whatever frequency that they need to keep their body in balance with the demands of their lifestyle, and that goes for pediatric patients too, then they're able to stay healthier than those who leave it to chance and allow things to accumulate with time. If you'd like us to take a look at your child, to take a look at what we can do to help their spine develop, to recover from injuries, or to restore normal posture, normal alignment, normal motion, normal nerve function, we'd love to take a look. We'd love to help. Reach out to us, click below, give us a call, and let us know how we can be of service to you. Thank you.